the student affiliates of 17. First, I want to thank everyone who is participating today. I know Dr. Cunningham and I are very excited to be doing this webinar. Before we get started, I wanted to give an overview of how the webinar will run. On your screen, you'll be able to see a Q&A button at the bottom. This section will allow you to ask questions throughout the presentation. I will facilitate the discussion between all of your questions and Dr. Cunningham as your mics don't work. So feel free at any point throughout the webinar to ask questions. An additional comment we would like to make is the information presented in this webinar is not in any way telling you what you should or shouldn't do with the client, but merely providing you all with information. We encourage you to seek other resources, including trainings to develop expertise in implementing these interventions, as well as consultation with your supervisors to assess the appropriateness of this content with those clients. Dr. Cunningham will be leading the webinar on Spirituality and Trauma Part 1 today. She's an associate professor at Fordham University, where she focuses her research on spirituality, trauma, and vicarious traumatization. Dr. Cunningham is the author of Integrating Spirituality in Clinical Social Work Practice, Walking the Labyrinth, and is also co-authoring a book on women and spirituality called Dancing the Labyrinth, Women and Spirituality, which should be available later this year. And with that, I would like to pass it over to Dr. Cunningham.
Thank you, Scott. Thank you, everybody. Appreciate your joining us for the webinar today. Today's topic, we're going to talk about the experience of how trauma can affect a person's spirituality. We'll ground our discussion in cognitive theory, specifically the role that an individual's worldview has in how they interpret the events that happen to them. I'll use the term suffering to conceptualize the aftermath of traumatic events because I think it better captures the anguish, the spiritual anguish that often accompanies traumas. So before we begin, some just basic thoughts. Suffering is endemic to the human condition. As the Buddha tells us, suffering is inevitable. As mental health professionals, we attempt to ease suffering, but we recognize that we can never eradicate it. And when we think about suffering, some questions arise. Why do bad things happen? Why does suffering exist? And why does evil exist? Some of you may be familiar with the concept of worldview, but I'd like to give a brief general overview to begin our discussion, and then we will discuss the spiritual component of a person's worldview. Our worldview is made up of the beliefs, assumptions, and thoughts that we have about ourselves, others, and the world. It provides a frame of reference or a personal theory of reality that we use to understand the events that occur. It develops over the course of our lives and is shaped by our experiences, our socialization, and our cultural group. Once established, it provides an interpretive lens to understand subsequent interactions. So, for example, if you learned early that you can rely on those around you, you are more likely to be a trusting person. And until proven otherwise, you will expect that you can trust and rely on others. Here's an example of how that plays out. You go to the store and the cashier gives you the wrong change. If you are basically trusting, you are more likely to assume that the cashier made a mistake. If you have learned that you can't trust others, you are more likely to assume that he or she tried to cheat you. Many of the assumptions and beliefs that make up our worldview stem from our psychological needs for safety, trust, control, and esteem, just to name a few. Our worldview allows us to function effectively and efficiently in a complex world. Despite the things that happen, we expect the world, though flawed, to be relatively stable and predictable. Once established, our worldview tends to be resistant to alteration. We are often unaware of our beliefs and assumptions until they are challenged. Spiritual beliefs and assumptions are an important part of our worldview and are often overlooked in both assessment and treatment. Spiritual beliefs related to our worldview include whether or not we believe in God, what we see as our purpose in life, how we find meaning, and what we see as the cause of suffering. Critical to our discussion today is the individual's use of spirituality to find meaning and purpose in life and in coping with suffering. The existential psychotherapist Yalom says, it is impossible to live without meaning. Nietzsche tells us, he who has a why to live can bear almost any how. And during his Holocaust imprisonment, Viktor Frankl observed that those who found some type of meaning in their suffering were more likely to physically survive than those who had despaired. Let's look at what happens to our worldview when it is challenged. We respond when something goes wrong in one of two basic ways. Drawing on Piaget's cognitive theory, we understand that if the event is minor, we are often able to assimilate it into our existing worldview. But if the event creates a great deal of cognitive dissonance, we need to change our worldview in order to accommodate the event. To assimilate the knowledge from events that are stressful but not traumatic, we may need to make some minor adaptations. But for the most part, our beliefs and assumptions continue to work for us. We may use a variety of cognitive strategies to assimilate the new information so we can maintain our existing belief system. For example, selection bias. We notice what fits our assumptions, and we either do not notice or we minimize what doesn't fit. Stereotypes are an example of this. Whether positive or negative, behaviors that fit a particular stereotype that we have are noticed. But when we encounter someone who doesn't fit it, we might dismiss it, or we might unconsciously decide that they are an exception to the rule. So our beliefs and assumptions are unchanged. We make the observation fit when what we previously believed. Or we might engage in blaming the victim. If we hear that someone had an unfortunate experience, for example, they were diagnosed with lung cancer, we might immediately think they must have been a smoker. Or we find some other way via social comparisons to continue to feel safe. They are much older than I am. They don't exercise like I do. Or in some way we conclude that they are different, and therefore we are able to maintain our illusion of safety. Underlying our understanding of the cause of negative events lies what's called the just world hypothesis. It states that people get what they deserve and deserve what they get. For some spiritual individuals, there is a belief that a loving God will guarantee people get what they deserve. We don't use these cognitive strategies to be mean or uncaring. We just want to feel safe. So we need to find a way to preserve our feeling of safety. When traumas occur, we cannot fit the experience into our worldview. The event so overwhelms our capacity to cope that our assumptions and beliefs are shattered. Depending on the type of trauma, we do not feel safe. We do not feel we can trust people, or our view of humanity greatly diminishes. We went from coping in what we thought was a stable, fairly predictable world to one of chaos and confusion. We are lost and floundering to make sense out of what happened. Many trauma scholars believe that this shattering of a person's worldview is the most painful aspect of trauma. Because spirituality is a part of our worldview, it may be directly affected by traumatic events. The trauma survivor desperately needs to seek to understand why the event occurred and to find some kind of meaning in its aftermath. It is natural for the survivor to ask, why did this happen? Why did this happen to me? Is there a God? How can there be a God if this suffering occurred? How could God allow this to happen? What kind of a God would allow this to happen? What did I do that God allowed this to happen to me? Along with these questions, there may be anger at God, which for many is frightening. One interesting phenomenon for therapeutic exploration is the individual's image of God and their understanding of God's nature. The person may state that she believes in a loving and benevolent God, but in the aftermath of trauma, she may actually reveal that she fears a vengeful and punishing God. The questions clients raise in the aftermath of a trauma highlight two areas for therapeutic work. How is our client coping spiritually with this suffering? And how do I address these questions in treatment? Pargament defines spiritual coping as the search for significance in the face of stress. Areas of our client's spirituality that may be disrupted are his belief in God, her understanding of God's nature. It may have gone from a loving God to a cruel God, and his sense of meaningfulness. The survivor might say, "Why bother going on? What is the purpose of my life now that this happened?" As humans, we need to see the world as coherent, and trauma shatters that. In the wake of trauma, spirituality may help the survivor cope, or her spirituality may be shattered. Brown recommends that therapists not only explore the client's meaning maker in the aftermath of the trauma, but also prior to it. If we don't understand how the client coped before the event, we're not really sure how they're coping with the event. For those who have used spiritual beliefs to cope with life before the trauma, we need to assess whether these beliefs are resilient enough or sturdy enough to sustain them through the tragedy that they encountered. When they do not, there may be not only the pain of not being able to rely on them, but also a sense of guilt or even fear that they no longer can believe what they previously believed, or that they are questioning God. The core of successful coping is the individual's ability to comprehend their suffering and find some sense of meaning in it. For those who are unable to cope and find meaning, it is important for us as clinicians to remember that this is an existential struggle. It is not a sign of weak faith, nor a sign of pathology. It's just a natural process in the wake of what they've endured. Pargament proposes three spiritual coping strategies. The first coping strategy is conservation. Similar to Piaget's theory of assimilation, the person tries to fit the experience into his existing spiritual beliefs. According to Pargament, many people will go to great lengths to do this, to hold on to their beliefs when coping with the negative events in life. When a trauma occurs to someone they know or another community, the person may use some of the cognitive strategies I mentioned before. For example, the individual may find some way to blame the victim so he or she can continue to feel safe. When tragedy befalls them, however, they may need to reframe the event so it fits their existing beliefs. For example, they may see their suffering as spiritually beneficial and a means to spiritual growth. In doing this, the person is able to preserve a sense of benevolence and meaning in her world. You might hear the client say, "God doesn't give you more than you can endure," or as God closes one door, another opens. Appraisals, however, may be negative. If the individual sees the trauma as a deserved punishment from a just God, he may preserve his belief and image of God, but it comes at a great cost of suffering, usually guilt, shame, and fear. For some survivors, there is a period of questioning which can be quite painful, but after a period of time, they turn back to their previous beliefs. Some people cannot fit the experience with their belief system. They struggle to reconcile their image of a loving, just God with their suffering. But unlike those who, after a period of questioning, are able to return to their spiritual beliefs, those who use this coping strategy are unable to do so. They are, however, able to find an alternative belief system that provides them with a sense of meaning. So their previous beliefs do not work, but they are able to replace them. For example, they may gravitate towards a new spiritual community, they may explore a new religion, or they may find meaning in nature. For some, this leads to a deeper spiritual connection than their previous beliefs provided. So after a period of spiritual questioning and exploration, there is spiritual growth. The third coping strategy describes those who are not able to return to their previous beliefs because they no longer fit how they see the world. But unlike those who are able to transform their beliefs, they're not able to replace them with anything that sustains them. They are left with no spiritual anchor. This is the most painful consequence for trauma survivors. These individuals lose their beliefs at the time when they most need to rely on them. So to summarize coping strategies, some people are able to rely on their spiritual beliefs to support them through their suffering. Others, after a painful period of questioning, are either able to return to their previous beliefs or replace them with a new meaning system. And some lose their beliefs and are not able to find anything to replace them. One comment before we go on to working with your client's spiritual questions. There are people who grow as a result of adversity. But as practitioners, we need to not romanticize suffering. Rabbi Kushner, in his book, When Bad Things Happen to Good People, says about the loss of his 9-year-old son, I am a more sensitive person, a more effective pastor, a more sympathetic counselor because of Aaron's life. And I would give up all those gains in a second if I could have my son back. If I could choose, I would forgo all the spiritual growth and depth which has come my way because of our experience, and be what I was 15 years ago, an average rabbi, an indifferent counselor, helping some people and unable to help others, and the father of a happy, bright boy. It is difficult to see people suffer, and we may feel at a loss to know how to answer their unanswerable but inevitable questions. Our own spiritual beliefs may be challenged when our clients question the existence or nature of God, the meaningfulness or meaninglessness of life. Park says it's important to include spirituality in working with clients' meaning-making process in the wake of trauma. But he points out that the professional literature on how to do so is scarce. Before I offer some suggestions about how we can work with these questions when clients raise them, I want to begin with what not to say. Theodicy is an attempt to intellectually defend God in order to maintain the view of God as all good and loving in the midst of suffering. When we try to do this, we are in the world of ideas. We want to solve the puzzle with our intellect. But suffering dwells in the emotional and spiritual world. The questions our clients ask when they suffer are understandable. But when we try to answer them, we wade into treacherous waters. The truth is, what answer could possibly help? Examples of theodicy are, it's God's will. With this response, the world is comprehensible, but harsher. We blame the one who suffers for his suffering. Another example is suffering is a tool for spiritual growth. This romanticizes suffering. It denies that evil exists or it trivializes it. Events such as the Holocaust can never be reframed as having benefits. Swinton argues that this presents a God with such little imagination that the only way to teach one to grow is through the, quote, random infliction of tragedies and atrocities. Other examples are God left the world imperfect and challenges humans to heal it, or trauma is a wake-up call. Like physical pain, it's an indication that something is wrong. So the problem with theodicy is it might make us feel better. It might preserve the person's view of God, but it creates many psychological struggles. Theodicy also points out the potential for countertransference reactions. Sometimes therapists find that these explanations give them meaning when they suffer, and they want to share them with clients. But it's critical to not impose that on clients. Our role is to explore those questions with them, not to provide answers. When you provide the space to allow them to explore them without judgment, without trying to push them towards a resolution, they may come to find some meaning in their suffering, but we cannot decide for them what that meaning should be. These questions are unanswerable. There's a humbling silence in the aftermath of these reasonable but unanswerable questions. It's unfathomable. So here's some possible responses. When clients raise these questions, we can explore them. Usually when someone asks that question, whether it's why did God allow this to happen, they've had some thoughts about it themselves. So we can ask, what thoughts go through your mind when you think about that question? See what they say. Often, the exploration will reveal some type of irrational sense of responsibility or guilt and shame. We can then slowly peel back those layers. What would be the reason God might punish you? Tell me how you feel responsible for that. We know from a large body of research in social psychology that often people will find some way to feel responsible because it is less threatening than concluding that they have no control over what happened in life. Another area to explore is to find out what other people might be telling them about the reasons the event occurred. So basically, we're assessing to what extent is their support system or their people in their environment supportive or blaming them for what happened. And probably the best intervention is to just, in quotes, listen. We minimize listening. Even the word just implies that it's a lesser intervention. Wellwood, who integrates psychotherapy and Buddhism, comments that when we listen, truly listen without trying to change things, we provide a gift to the client. We afford him the space to have his own experience just as it is. So we can support the question. It's a natural question to ask. It's unfathomable that this happened. This allows the client to keep asking the questions, even though there's no answer, until they no longer feel they need to ask it. We help them find a way to live with the unanswerable questions. So important in considering our response is that we are practitioners, not spiritual leaders, although some of you might be both. We are not theologians. We often will cause more anguish if we try to answer these questions. But because it's difficult to be with people when they're suffering so much, we also need support so that we don't give in and try to answer them. This may be our own supervision, consultation, personal support such as therapy or spiritual direction. This way we can hold the client's doubt, meaninglessness, and despair so that they need not bear this pain alone. I will end with a quote from a Jungian therapist quoted in Cornfield. There is in life a vulnerability so extreme, a suffering so unspeakable that it goes beyond words. In the face of such suffering, all we can do is stand in witness so no one need to bear it alone. So I guess we can open it up to questions, Scott?
Yeah. So one I have is, Dr. Cunningham, you mentioned their spirituality is helpful in potentially coping with trauma. Are there ways that spirituality can be harmful to coping or healing?
Well, I would say that for some people, their spiritual beliefs, they're able to maintain them and it helps them get through the trauma. They make some sense or meaning out of it. For others, I think it's shattered. And I think to answer specifically your question about it being harmful is that there's evidence that if people make a negative appraisal about why it happened, so they feel God is punishing them, their coping is impaired to some extent. So in that sense, I would say it could possibly be harmful, but it's not the spirituality itself. It's their way of trying to make meaning out of it, and coping is that they come up with, I must have done something to deserve this. So therefore they feel guilty and ashamed.
Okay.
That answer your question?
Well, we'll see if they say anything else.
No, I mean, does it answer your question?
Yeah, no, that I was reading that question from somebody else. So
oh, okay.
We'll see if they say anything else. And then someone says, are you making any difference between religious coping and spiritual coping? And if so, what is it?
Okay, that's a really good question. So I usually focus more on spirituality than religion, and obviously each religion has a particular set of beliefs that people may find helpful. I think one area that religion can be helpful is that for people who belong to a community, if that community is supportive, they have people that they can turn to. And often within a particular religion, there may be some rituals that they find healing. You know, so we know, for example, that people very often find when they've lost someone through death, that some kind of funeral ritual is something that helps them kind of figure out, well, where is this person now? What happens after someone dies? And the support of the community. Now, people who are spiritual but not necessarily connected or affiliated with a particular religion can find these things too, but they're not usually established the way they are in an organized religion. So people very often kind of know who to go to if they're affiliated with that group.
Okay. So I think it might be helpful if you could potentially differentiate religion versus spirituality.
Okay. So there is a lot written on people trying to differentiate religion and spirituality. Nobody's really been completely successful, but I think there are some guidelines. So I'm going to tell you how I define it in the work that I've done. So I see religion as more formalized and organized. It comes usually with a set of beliefs that people who affiliate with that religion usually believe to some extent. And it often provides a place for rituals for people, whether it's prayer services, and this is, in life in general, not just when negative things happen. Spirituality is usually defined as a broader concept. So it refers to how people make sense out of life, how they connect to their truest, most authentic self, how they connect to others, and how they connect to, for those who believe, in some kind of a deity, which most people call God or a higher power. But some people refer to it as the universe. There's a whole lot of ways that people can refer to this fact that there is something beyond us, some being that we want to connect with. So there are people who are both religious and spiritual, and they express their spirituality through a particular religion. There are people who are religious, but they're not very spiritual. They follow the dictates of their religion, but they don't necessarily feel that sense of connection to either their own self, to others, or to whatever deity they believe in. There are people who are spiritual and not religious, and then there are people who are neither spiritual or religious. One of the there's a woman, she's actually a Catholic nun called Sister Joan Chittister, who's out in Erie, Pennsylvania, and she uses the example, and others have too, that religion is the finger pointing at God. So, but it's not the be all and the end all. It's the religion is compared to a finger pointing at the moon. So the moon is analogous to the superior being that people believe in. And religion is a way to connect to that person. So there are a lot of people who express themselves spiritually without being affiliated with a particular religion, or they take bits and pieces from different religions and kind of weave them a spiritual belief system for themselves. So they may find a lot of interest in Native American spirituality. They might express it through time in nature. They may not believe in a higher power or a God, but they feel a commitment to social justice, and that is their way of finding meaning in their life and connecting to themselves and others. So there's so many variations, and I think the reason that it's difficult to distinguish the two is because there's overlap between religion and spirituality for many people.
Okay. We have another question.
Okay.
How might you suggest working with children who might be questioning the value of spirituality and their experience of a traumatic experience, such as child sexual abuse or neglect?
Well, that's a great question. There is a body of literature on child abuse, whether it's working with adults who were abused as children or whether it's children who are currently abused. My area of expertise is not as much in children, but I think when we talk in the next webinar about interventions, I'm going to talk a lot about creative art therapies that people can use. And I think that in terms of giving them a vehicle to express themselves, I think the critical thing is that we're not judgmental. And this is why I think that there's such potential for countertransference, is that if somebody's sitting there, session after session saying like, there can't be a God, there can't be a God, and you believe there is a God, or you're going through a period of time where you're a little shaky yourself, that can really be very threatening. In both books, I've included chapters on therapists, and in the upcoming one, I've talked a lot about dealing with people's doubts and questionings. But so I think the important thing when you're working with a child is to be able to give them that permission to question without necessarily giving them an answer. And again, I think you can say to them, well, when you ask that question, or you draw that out, it looks like here, like you're kind of wondering who was there for you when you went through this experience. That if they, when they give the answer, if they say, well, God was there, do they give it as it's a formal answer that they feel they're supposed to give? Or do they really believe that? And if it's a formal answer, you can just say, I think you can generalize and say, sometimes when children have experiences like you did, they question whether God was actually there. They question why an adult wasn't there to help them. So I think it's similar to working with adults in that you're providing that space for them to not believe for as long as they need to not believe. But the way they're going to express it, I think, is going to be much more through play therapy or creative arts, rather than they're going to sit down there and say, gee, I really, question whether there's a God when I think about having this experience. I think that's, too sophisticated for them. They don't have the verbal skills. And the other thing is that when people are traumatized, because they're overwhelmed, their capacity to articulate and verbalize things is very often impaired. Being a New Yorker on September 11th, I can tell you that it was like unfathomable. We could not come up with words to express what had happened. So for children whose language is newer, there's going to be even more of an impact on that. So, sometimes people work in faith-based agencies where they feel more licensed to be able to talk about what they believe or what the community that the child belongs to, their spiritual community, what they believe. I just think as practitioners, you need to make the distinction between is the child really, are we telling the child how they are to think, believe, and respond? Or is it that they do feel that way, they just need to be reminded that this is what our community believes, but it's okay to question it. So I think that it's a tricky line, and it obviously is based on whether you have a dual role as a counselor and a spiritual leader, or whether you're in a faith-based agency or not. So I guess to just summarize, giving them the space to question, giving them material so that they can express themselves in the way color. I think those are vehicles for working.
Okay, thank you. Are there specific spiritual concerns and considerations to address depending on the type of trauma? For example, sexual, physical?
Some of the literature on types of trauma, this is actually something that I was personally interested in, so I did my dissertation on. When it is a human-induced trauma, such as sexual abuse, rape, murder, anything where a person intentionally did harm to another person, one of the areas that it affects is the person's ability to see humanity in a positive way. So I've worked like with adolescents who, because they were abused by a male, they're like, they don't trust any males. Not recognizing that this particular male abused you, but not all males are abusive. So in that way, there's a lot of factors that influence how a person responds to a trauma, not the least of which is how are they coping prior to the trauma. But factors like how old they are when it happens, whether it's a chronic trauma, whether it could be anticipated, Um, did they lose somebody as a result of the trauma? Were they physically harmed? If it was an individual that did this to them, what relationship did they have? So a parent or somebody known to the family, a relative, a trusted adult, is going to have more of a devastating impact on the child who had the trauma than if it was a stranger. Like the stranger, you can kind of find some way to ultimately come to terms with, like, they're a bad person, but everybody else in my life is good. But if the people who are supposed to protect you and provide nurture for you are the ones that harm you, it's very, very difficult for people to process that.
Okay. It seems that if spirituality simply means having a worldview, why would that worldview necessarily involve some form of supernaturalism?
I'm not quite sure I understand the question. What do they mean by supernaturalism? Do they mean a deity, or do they mean what? Could they clarify that a little bit?
I'll ask the person who asked that question.
Okay, sorry.
No, you're fine. If you could potentially clarify that question a little bit more. So we'll move on to the next question, and if they...
Sure.
So the next question is there at any point when you would start to incorporate someone's spiritual leader or religious leader to help cope or heal?
Yeah, that's a great question. One of the things I think we talk about, and actually, Scott, I think you had raised this as a possible question that might come up, is what if your belief system is very different from your client's belief system? Mm-hmm. And I think that can be even as broad as, the therapist is a non-believer and the client is a strong believer, or the therapist is a strong believer and the client is a non-believer. Some of the literature talks about sort of almost automatically referring them to a spiritual leader. I think there's a few things that need to be thought about. One is, it's a really good idea to have a group of spiritual leaders that you can refer to, that understand psychology and how to work with people from a psychological perspective, so that they can deal with all those underlying issues of why this person is asking the questions. Not just, here's the dogma and here's the evidence of the dogma. The other is that when people are going through a crisis of faith, it's really important that it's going to be somebody that's going to be sensitive to that and allow them to have that space for that to unfold. So if you're referring them to someone, it has to be somebody who understands that need and doesn't say, like, well, you're not supposed to believe that way. This is what you're supposed to believe. And if you're going to refer the person and not continue to work with them, the referral needs to be done in a way where the person does not feel they either overwhelmed you and you can't cope with them, therefore they're going to overwhelm everybody, or it's an abandonment. I don't believe, therefore you don't want to work with me, because people are very sensitive, and how they personalize things may not be the way we intended it. So I think that if you do decide that this is somebody that you can't work with, that they really need either that you don't, well, I would assume if you're on the webinar, you're probably interested in including spiritual issues, but some people aren't, or feel you're not supposed to. But if you feel that, I can't work with this person, I don't understand enough about their belief system, that you let them know that, their questions, their situation is really understandable, and you want what's best for them, and that of somebody in the community who has expertise in this area, and that you wondered how they would feel about talking to them. And you can maybe check in with them to see how they're doing, so that they know they're not totally abandoned. But to make that referral really clinically sound, and to definitely know who you're referring to and whether they're going to work well with people who have these kinds of concerns and questions. Because sometimes they're better off staying with you when you struggle through it, because they know then. And the other is, you can go out and get more training in working with that particular group. The other thing is really important in terms of ethics, is to distinguish that we are therapists, and we can answer questions about dogma. Even if you're from the same faith system or belief system, it's actually interesting. I co-taught a class with one of the Jesuit priests once. So I'm a lay person, a woman, he's male, he's Jesuit. And he talked about that he has a private practice, he's a psychologist. And he had a woman who, in the course of treatment, revealed many things where she ultimately decided she wanted to go to confession. And he would not hear her confession because he felt he was her therapist, he was not her confessor. So he referred her to somebody else to hear her confession, to like clearly clarify that role. Now, other people might make a different decision on that, but I think that it's, when we get into a theological debate with clients rather than therapeutic issues, I think we're not helping them for the reasons that they're coming to see us rather than going to a spiritual leader to ask, I don't understand what this dogma means and how it fits in with my experience in life.
Okay. I think that another question is related to this. So
Okay.
How do psychologists define or draw the line between being a psychologist and versus being a spiritual counselor / pastor?
Yeah.
Are there things a psychologist is not supposed to do?
Okay, well, first of all, I'm a social worker, so you're going to have to get the social work answer on this. So if you are both a psychologist and a spiritual leader of some sort, you've had training in both those areas. I think that, when you're working with people, that you need to think about what is your role and what role do they want you to be in. And some people want you to be in both of those roles. And I think as long as that's clear, that they're going to you because you're a spiritual leader, but you're having some psychological reaction to whatever it is that you're experiencing in life. And you are finding it very helpful that your spiritual leader understands psychology, has counseling skills to be able to work with you in that capacity. I think they're going to you and as a spiritual leader who also just happens to be well qualified to do the counseling. If they come to you as a counselor and you also have that expertise, I think that needs to be a conversation that you have with them. And I think because clients very often think very highly and get attached to the counselor, I think we have to be careful that we don't just assume that they say, oh, sure, it's okay that you include that, if they're not really ready for that, or it would be better if somebody else provided it. So we had done a training for clergy, and the woman, when she worked with people, and she was Christian, and she invited Jesus to be a co-therapist with her in the room with the client. And we kind of raised concern about that. And she said, oh, no, it's fine with the client. But she really failed to understand the power dynamic of that client really didn't have freedom to say no. I mean, who really is going to say, no, I don't want Jesus here if they're Christian? And this was their pastor. So I think it was a real blurring of the role. I think it would have been better for her to, if she found it helpful, to pray before the session by herself and to pray afterwards for the client. Those were ways that she could have implemented that in a way that would have been helpful to her as the counselor. I think, many of us realize that in some ways we're just a vehicle for what happens, whether you believe in a spiritual world or not. A lot of times we just know from our internal wisdom, we come up with things to say to clients that are really right on. But I think I think we always have to look at the power dynamic in treatment. As much as we say we're collaborative and egalitarian and the client is in charge of the treatment and all those kinds of things, the reality is that clients very often invest a lot of power and authority in what we say. So to ask them, is it okay if I include this in your treatment? They may not really feel free to say, I really rather you wouldn't. I know I'm giving a lot of it depends answers, but that's what I tell my students in clinical social work. It really does always depend, which is why I really do encourage you to talk further with your instructors, your supervisors, your consultants, to really make the right decision for your client and for you.
Okay. Thank you for answering that.
Okay.
Are there any specific concerns with interfaith relationships with like client and counselor that people should be aware of?
Yeah, well, certainly when you get to the more basic, believer versus non-believer, um, I think that I actually think there's also some potential complications even when you come from the same belief system. Um, that again, we're human. It can be threatening to have people questioning things that really provide a sense of meaning and purpose in our own lives. I think we can assume that people believe what we believe because we have the same label. Um, I think it's really important to find out that if somebody says they are whatever affiliation they are, that we really find out what that means to them. Um, are they at a point where they really buy into the beliefs, or are they questioning them? Because we may just assume I can tell you to rely on this because I know that that's what I would do, when it's different. And then I think when it comes down to that, the person is, you're a believer, they're a believer, but you have different belief systems, to be really respectful of, so you are a fill in the blank, what is it that you have learned to believe in this situation? What is it that you have learned is um, the reasons that these kinds of things happen? And to work with whatever it is that they tell you, because regardless of the fact that people may belong to the same faith organization or group, everybody's had their own personal upbringing and how important these beliefs were or not to their family, significant others in their lives, and experiences that they've had all through their lives. So they come to us at a particular point in their life, but they've lived life up to that moment, and may have had really strong moments of connection, or they may have moments of disconnection. I think the other area, which may or may not be related to the question, but I'll just throw it in, is people have had very, very deep spiritual experiences, are very often as hesitant to share them with their counselor as are people who are on the verge of believing nothing, because they don't know whether people will believe they had that experience, particularly as things get more towards like kind of a mystical experience, whether they will be labeled as, it'll be labeled as psychopathology. So to just be aware that sometimes clients are kind of hinting at that they have had an experience that they might themselves even feel is unusual, and whether they feel free to share that with their counselor or not.
So this next question might get into the second webinar, but
Okay.
you might be able to answer it. And so you mentioned crisis of faith. And so how might that affect the counselor, or how can they start to manage some of that if they identify as spiritual?
Okay, so you mean the effect on the counselor?
Yeah, it looks like it.
Okay. I hadn't planned that for the second webinar because that's really more the role of the what doing this work does for us and to us. A person's spirituality is really very personal and very, in many ways, I think, unique to them. And if you're in a period of strong belief and connection, you may be able to hear and listen to a lot of doubts, a lot of concerns that people have. Whether I'm going to just use the word God and God's nature because it's just easier to go into all the divine, deity, higher power. So I think that support and finding ways to nourish your own soul, if I can use that word. And for some people that may be their own spiritual practice, but I think it also includes things that fall under the broad category of spirituality. It's like, if nature is what really helps sustain you, and you're working with clients who are really going through difficult times and questioning, you might want to try some way to incorporate time to be out in nature. It may be that you need to participate in the rituals of whatever a group you're affiliated with. You know, I'm sure counselors are just like social workers, and that taking time for yourself is just really something that very often doesn't come. I know many of you are students, so you have even less time to devote to yourselves. I like the concept. It starts as a religious concept, but I don't think we have to take it in the religious sense. The idea of Sabbath time, that there is time set apart from our usual week, month, because we very often can't do a whole day a week. But time set apart where you schedule it into your schedule as a me day. And that should be a day that you do things. I've given talks on this where, like, if a spa day is not your thing, don't go to the spa on this day. This is supposed to be a day where you do something that you really enjoy. So go out to the beach or the mountains or the lake. You know, just spend some quality time with yourself reflecting on, if you want to reflect on these clients and the difficulty they're having, that it's done, not that you're reading and going to a conference to learn how to work with them. Those are great things, but that's not your me day. Your me day is, how is this affecting you as a human being? How are you sustaining yourself so that you can work with them? Is it time for you to work with some other types of clients for a while until you can replenish yourself more? I think those are things that help you. Look, this is tough work. It's really tough work, particularly when you work with people who've had traumas, and when it affects the very way they make meaning in life, that can eat away at you. We coined a phrase in the upcoming book called vicarious meaninglessness, because vicarious trauma talks about people who have been traumatized, but clients can come in and have a spiritual crisis without having had a trauma. So how do we respond to over and over again here? And there's no point in life. There's no purpose. And like I said, I think there are times that we can tolerate that and say we can feel compassion for that person who's going through that, but it doesn't necessarily eat away at us. And then there are other times where we want to say, yeah, I know what you mean. And that's not really helpful to the client. You can't go down with them. So okay. I think, you know, consultations, however you define spirituality for yourself, that you nourish that, and talk to other people, other counselors, to provide a support group where you can sustain each other through those difficult periods of time, because they come and they, you know, like with clients, sometimes they come and they go. But it can be a really rough ride for the period of time that you're in that dark night of the soul.
Yeah. Okay. So I realize that we have 5 minutes left, and so I kind of.
Oh, really? Okay.
Yeah. I just want to start wrapping up. And so.
Did the supernatural person get back to you?
Yeah, I might refer them just to ask you specifically, because I'm having a hard time figuring out specifically what the question is asking.
Okay.
And it might just be because it's over my head. So. But I thought it might be nice if you could just give a little idea of what they should expect for the next webinar.
Okay, actually, if they have time, if some of them could send you some things they would like me to focus on.
Okay.
What I thought talking a little bit about is an approach to treatment. And these are things that some of them are specifically trauma related, some of them are more general, and they maybe can give you feedback, because you and I can talk before the next one too, about whether they want it just on trauma or whether they would want some general interventions. A little bit about assessing for appropriateness and using them, a mindfulness approach to treatment, and some specific things that we can do around that. The creative arts, I usually include something on guided imagery. I've done some stuff on some techniques for restoring hope and meaningfulness in the wake of trauma. I don't know. So is there something more specific that they want?
Someone said mainly trauma, but.
Mainly trauma, okay.
But some general.
Some general. Okay.
Yeah, so I think that's helpful. And so just for all of the viewers and participants, we will be sending out at the end of this, if you've registered, you'll get some of the resources that the webinar used today. And then you can use that as well to reply and give us some, if you have specific questions or things that you'd like us to talk about in the next webinar, we would appreciate it.
And you know, Scott, one of the things I could do too is like outline some ideas, and you could pass that around to them and see if, you know, yay or nay on them.
Sounds good. And the next webinar is planned in March, and we'll send out an email to get people registered for that as well.
Right.
Is there any last minute things you'd like to share with them?
You know, I'm very used to face-to-face with students. I can look out and kind of see who I've grabbed and who I haven't. So this is I have no idea who I'm talking to out there. You know, I hope this was helpful. If you have follow-up questions, I think that, you know, maybe you could send them on to Scott, and we can, you know, even take a few minutes in the next webinar to address them. You know, just having done direct practice work, just really admiring all of you for doing this. And we know that people really are hurting and suffering, and that you are someone who very often for small pay offers to be a witness to their pain and somebody who's trying to help them through it. I just, you know, kudos to all of you.
Okay. So I just want to say thank you, Dr. Cunningham, for presenting on the webinar, and then also for all the participants for asking questions and being engaged. We really appreciate it.
Yeah, thanks for the questions. So great.
So look out for the next webinar in March, and we will see you then.